Hello and welcome to the Day Health Strategies podcast, Unlocking Accountable Care, the healthcare podcast where we talk everything value-based care with the top experts in the field.
Hello and welcome to another episode of Unlocking Accountable Care. This is your host for this episode, Kate Gottung. Today, I am sitting down with a few representatives from Community Catalyst's Center for Consumer Engagement and Health Innovation. Many of our listeners will know Community Catalyst as a Boston-based but nationally focused nonprofit advocacy organization working to build the consumer and community leadership that is required to transform the American health system. Today, we are fortunate to have a conversation with a team from Community Catalyst. The center's mission is to bring the consumer experience to the forefront of health innovation in order to deliver better care, better value, and better health for every community, particularly vulnerable and historically underserved populations. To hear more about the work underway at the center and how it ties to accountable care, we have Dr. Hwang and Mark Rukavina. Thank you so much for being here, both of you. I'm just going to jump right in. So, Anne, can you share with our audience the professional journey that led you to your current position here at the center and how that fits into other roles that you've held?
Sure. So I'd like to start maybe just talking about the immediate transition that led me here to Community Catalyst, and then we'll time travel and go a little bit backwards. Prior to Community Catalyst, I was working for the Commonwealth of Massachusetts and very involved in a lot of payment and delivery system reform initiatives there. And while I was in that role, I was really struck by the fact that there wasn't a strong consumer and community voice in these very profound changes that were happening in the healthcare system. As a state official, you hear all the time from providers, from health plans, from stakeholders who are invested in the process, but it's always very hard to understand how your average person who was being served by these programs were experiencing these changes. So after I left state government, Community Catalyst actually received a grant from the Atlantic Philanthropies to set up a new center that was focused exclusively on building the consumer voice in delivery system reform initiatives. And I thought this is absolutely what had been missing in that role. So I was incredibly excited to jump, to take on this role and to establish the center here.
You're trained as a physician, and I'm wondering if you could share with us a little bit about how you got involved with implementing health policy.
If I go back a little bit, as a clinician, I've really interspersed an interest in both clinical practice and policy. And that really comes from seeing how influential policy is in people's lives. I remember when I was a medical student, I was a medical student in California, and taking care of patients in the context of a state that had a double-digit uninsurance rate. And we literally, in those days, which actually wasn't that long ago, but in the days of paper records and carbon triplicate order forms, would actually write on these carbon triplicate order forms to discharge people to the street, people who were homeless. And even then, I just saw the futility of sending somebody out with no follow-up for chronic conditions, without appropriate long-term treatment for the conditions that I knew, even as a medical student, was going to land them back in the hospital. And when I came to Massachusetts with the implementation of the state's expansion of healthcare coverage in 2006, the world had completely changed. It was incredibly rare that I would discharge somebody without follow-up or have somebody who didn't have any access to some kind of healthcare coverage. And it helped me to recognize just how profound the policies are that affect all of us and our ability to access healthcare.
The lens you have for looking at salient issues in healthcare today is very unique. Can you share with the listeners a little bit about your educational background and how this influences your work?
So I had promised to talk a little bit about why I have a master's in the history and philosophy of science. And I studied at Cambridge University, and I was very interested in the experiences of pregnancy and how pregnancy and childbirth were managed in 18th century Britain. And you might think that has no relationship to anything whatsoever and is certainly not a very practical degree. But when I look back at that time, I actually think that I was what I was really interested in at that time is something that I've continued to be interested in, and that's the role of power and how power and authority are constructed in clinical practice. So the 18th century, for those of you who don't know, was the century in which childbirth started to be managed by men. It was a domain from which they had been completely excluded, and yet they came in saying, actually, we know what's going on here, and we're the experts. And I was very interested in how these new practitioners constructed the idea that they actually had the knowledge and the skills to manage a domain that they had not been involved in previously. So if you take the long view, those themes of power, who has power in the relationship, who has authority, who has knowledge, those are themes that have run throughout my career and my work.
Wow, that's a really interesting perspective. There are so many different things to consider when we think about establishing a medical structure that can consistently offer patient-centered care. What do you think are the most important aspects to consider, and how does Community Catalyst address them?
I think that's a great question, because I think oftentimes it feels like there's so much going on in all the different domains of healthcare that it's hard to keep track. You know, in our work here at the center, we really think of healthcare, a consumer-centered healthcare policy as having three arms, and these are all equally important. One is coverage and access. The second is the quality and delivery of care. And the third is addressing the social factors that affect health. I think paying attention to all three of these and how they interconnect is vitally important. There is activity happening at both the state and the federal levels. You know, if I had to throw my hat in one, I would say that there's a lot of very proactive, forward-thinking work that's happening at the state level, especially on those latter two aspects that I mentioned around improving the quality and delivery of care and addressing the social factors that affect health. But that said, those two pieces don't work unless we ensure that people have that strong coverage and access foundation. And that requires a lot of advocacy at the state level, but also particularly now at the federal level.
So my next question is, the consumer voice is such a critical role in improving the care we provide in our health systems. Can you tell us a little bit more about how you do that?
Yeah, absolutely. You know, and as I mentioned earlier, really came to this work because there was such a lack in consumer voice in designing these healthcare programs. And yet, you know, as health reform is happening, we really have a once-in-a-lifetime opportunity to restructure the way that the healthcare system operates. So we set out basically to find out the answers to a couple simple questions. You know, the first of which was, could this even be done, right? Like if you go out and talk to people and say, hi, I'd like to talk to you about accountable care organizations and how your care is organized and how healthcare is delivered in the U.S., will people even talk to you? And so that was step one, is were people even interested? And so what we did is we supported partner organizations in 6 states to go out and reach people in the ways that they thought would be most effective for their community. So that included, in some cases, knocking on doors, in some cases, putting ads in local newspapers, some cases, speaking to church groups, going to senior centers, organizing town hall meetings, and then telling people about what was happening in their community as it pertains to accountable care. And then making an ask of, would you like to be involved? So we wanted to find out, first of all, could that be done? And so over the last 2 years, our partners reached out to almost 30,000 consumers, and we were focusing particularly on consumers who are served by public programs and people who have complex health and social needs. And what we found was about 5,000 people said, sure, tell me more. I want to learn a little bit more about this. So then the next step was, how do you take these individuals who've expressed an interest and get them to build their leadership in this area? You might, I think for many of us who work in this space, I think we struggle many times, I often do, with the complexity of these systems of care. They're big. We're trying to move policy that's very detail-oriented, that sometimes sounds very arcane. And we wanted to understand, how could we get people interested and to take action in some way? So go meet with a legislator, go to a advisory committee meeting, talk to the state leadership about your concerns or your hopes and dreams or your fears about a new program. And so the next phase of it was, how do we get people to become consumer leaders? So we found that of those 5,000 people, we were able to develop about 1,000 consumer leaders who were taking action in this area. And along the way, what we found were some of the best practices, how you connect with people, how do you communicate about these issues, how do you foster a sense of community. And what's really interesting to me, and I know you'll be hearing from my colleague Mark, is that I came to this work from a clinician and policy background. Mark came to this work from a community organizer background. And this is where we really meet in the middle. And what we're doing is we're doing the work of community organizing, but around healthcare. So one of the things that I would say that has been really profound for me is I did this work because I was really interested in improving the healthcare system. And what I've really found is what we're actually doing is we're transforming people's lives. And through that process of engagement and advocacy. And that's the piece that has been incredibly rewarding.
I want to go back to your unique perspective as a physician. What do you learn from your patients that influences how you think about your work at Community Catalyst?
Yeah, I think on the one hand, working as a physician gives you a frontline seat into all the ways in which the system can go wrong. How many things have to go right in order for people to get the care that they need in a culturally competent way that's timely, that is the right care at the right time, all the different moving parts of a system and all the ways in which they can malfunction. You really have a strong appreciation of that. So it gives you a certain amount of humility when you're trying to think about policy, because you just have a visceral understanding of all the ways that when this hits the front lines, incentives can be structured incorrectly. I think about some of these things around quality measurement, like when there's a big push about whether people with pneumonia in the ER were getting IV antibiotics, which wasn't necessarily the appropriate treatment, but it set in motion a set of clinical practices that were not particularly evidence-based. So even things that are very well-intentioned, can have consequences. And certainly on the policy side, we see that when people have trouble, accessing providers, when they have bad experiences with providers, when they aren't able to get eligibility approved for programs, and the gaps that happen. I also want to say, though, that the things that I see are the wisdom and expertise that consumers and patients bring to the table. And in particular, in working with people with complex needs, I have started to approach a lot of medical diagnosis, as a partnership. People have talked about how medical care is really, it is a service. It's not a good. It's not a widget. And as such, it has to really be co-produced or co-created with the person who is the patient. So I've learned, so much from the patients that I've cared for in terms of what they bring to the table, their expertise, their ability to problem solve with me, and the ability to find solutions together. And I think that's the piece that we want to see at the policy level as well.
Great. Thanks so much for sharing, Anne. I think now it's time to transition to hear from Mark. Can you tell us a little bit about your career path and how you ended up here at Community Catalyst?
Okay, so Anne kind of started closer to the present, and I'm going to go to the way back. I was fortunate to be born into a family that really valued social justice and giving back. Those were values that were instilled in me and my siblings by my parents. And they were active union members, so Anne spoke to power earlier. That's something that we were well aware of growing up. And the importance of organizations in building consumer power. In the case of my parents, the labor movement was very important. So as I began working, I kind of gravitated to community organizing. And one of my first jobs was with an organization focused on older adults, where healthcare is obviously an important issue. The organization wasn't exclusively focused on healthcare, but healthcare is vitally important to older adults, and that's where I began working on issues related to healthcare. So I've spent many years working with consumer-based organizations, the kind of organizations that Ann mentioned in her experience in state government were oftentimes missing from discussions around healthcare policy. And I had the good fortune of being involved with organizations that really tried to make sure that the consumer voice was represented in policy discussions. So I've worked in that space for many years. Had a couple of years where I worked with a hospital, a public hospital that had a mission to serve underserved populations, and did community health work with the hospital. But predominantly I've worked in the consumer advocacy space. And as you mentioned, I, prior to coming to Community Catalyst, had my own consultancy working with hospitals and health systems. And I was looking at that point to kind of expand beyond that, and hoped to join an organization that was doing more expansive work than just that. And was delighted to learn a position at the center, and really, really thrilled to join the team here as we work to transform the healthcare system. So my experience as a community organizer is similar to a lot of the partner organizations that we work with through the center and at Community Catalyst. Ann brings clinical expertise that we did not have prior to Ann joining and the center. And it's nice to kind of bring these different experiences and skills together. And I'm learning a tremendous amount from Ann and her perspective as a provider. And we have a fabulous team doing this work.
Wow, that's so interesting. I'd love to hear more about the ways in which business development has shifted here at the center as we move towards providing more value-based care.
So Ann talked about the partners that we have at the center, and the bulk of our work is done with consumer-based organizations. I'm, as you said, the business development manager, so my role in the center is to oversee our consulting services, and we consult to healthcare providers, to health plans, to hospitals and health systems, public programs, and other nonprofits. And the work that we do at the center is focused on consumer-based organizations. The work that I oversee in the consulting work is really focused on the healthcare entity. So it's the flip side of the same coin as we try to transform the healthcare system. Making sure consumers are involved in these efforts is important, and providing the kind of guidance that we think is important to the health entities is what we're doing through our consulting services. We have fabulous clients that we work with. They have a mission to serve populations that are historically excluded, underserved populations, people with complex health and social needs. And they come to us because their expertise is not really in engaging consumers or community partners in their work. They're focused on their, clinical services, for example. And they're looking to us because they have a real commitment and a mission to serve more effectively the populations they're trying to reach. And many of them are looking for strategies and structures to meaningfully engage their patients, consumers, the broader community in which they operate. So that's why they come to us, and we leverage the expertise of an organization with 20 years of history working with consumer-based organizations and doing this work.
What are some of the ways that you encourage partnership with communities to elevate the voice of the consumer?
Well, there's some ways that may be obvious, but we think are very important. So having patient-family advisory bodies is one example of that. And some of the listeners may be familiar with community or patient-family advisory councils. And we work with health plans, we work with accountable care organizations, we work with hospitals to establish those types of advisory bodies and think about ways in which to really engage those members of those bodies in partnership in the work that they're doing. Ann mentioned the importance of partnership as a clinician. And, we really work with the health entities to provide training to their staff, as well as training to the members of those advisory councils, and that's just one way to to approach partnership with communities. I think that for health entities, having patience and understanding this is a long-term commitment is very important. We work with a number of health systems and others that have made that kind of long-term commitment. It's not just about advisory councils. I mean, we continue to develop our description and language for the work that we do. I mean, consumer engagement's our middle name, right? The Center for Consumer Engagement and Health Innovation. And we're talking about meaningful consumer engagement. And we're hoping that we can help our clients move from a transactional way of engaging with patients and consumers or the broader community to more of a transformational way. And, we've seen examples that are very powerful where programs have been co-designed with patients, with the populations they're intended to serve. It kind of seems like, that it shouldn't be that surprising that it's important to involve people in the design of policies and programs that are intended to serve them. But oftentimes it's challenging to do, and or it's shortcuts are taken. So we're really working with our clients for long-term commitments in processes and developing structures and developing partnerships that are trusting and transparent, so that the skills that people with lived experience can be leveraged in a way that's better for all.
So really your efforts are to encourage organizations to go above and beyond simply being compliant to the various aspects of providing value-based care and truly understanding the needs of populations being served.
Yes. We're hoping to do much more than just helping organizations, comply with requirements and check the box. But, there are organizations that are challenged by doing that as well. So we work with a range of organizations. Again, most of them, I think, have a real mission to serve and are committed to working as effectively as they can with their communities or with their patient populations, but again, don't have the necessary skills for doing that. And I think some of them understand that they need assistance and are interested in learning what other organizations are doing too. So, we take all organizations interested in exploring partnership and the services that we provide. And for some of them, we hope that are, maybe more concerned about checking that box, that we can move them beyond that.
Can you tell us a little bit about the work you've done in other states?
Yeah, we've had the good fortune of working in a number of different states with various state agencies. Generally, they have some type of consumer patient advisory body, and we've worked with them around strategic planning retreats, developing strategies for engaging with patients or particular populations more effectively, working to address issues of health equity, for example. I think that sometimes that has helped influence policy or regulations that are being written. We'd like to think that we're making a contribution in that way. And we've also done work at the federal level. We have done for a number of years now a series of webinars with CMS on geriatric competent care and meaningful consumer engagement. So we're working, at the local level with institutions. We're working at the state level on policy, and working at the federal level, as Ann said as well.
I think we do have a few resources that look at accountable care organizations and a checklist for advocates or policymakers for a lot of the features that we think are helpful in promoting a more consumer-centered accountable care structure. And that includes a number of recommendations around consumer engagement and strategies there. basically, if a lot of states, are starting to understand that accountable care is a learning curve for providers, for example, and there are a lot of efforts to help providers adapt to these new models. But we would argue that it is also a learning curve for consumers and for people who are being served by these programs. And that same attention to consumer engagement, building in feedback from consumers is really important. Consumers can also be incredible allies in helping to issue spot early on as you start to roll out these very complex models, because they're on the front lines. They spot when things aren't working well, and it can help states have that feedback loop to recognize when you need to take early action and make course corrections midway.
Yeah, and those feedback loops are vitally important. I mean, it's a quality improvement cycle. And as we talk about accountable care, I mean, it's hard to imagine accountable care without consumers being directly involved with that. So the resources Ann mentions that we have at the center have all been developed, for example, in partnership with the organizations that we work with. So consumer voice is really represented in the materials and in all the work that we do.
Thank you so much for both of you being here. It's super informative, and I think that's all the time that we have. So thank you to our listeners for listening to another episode of Unlocking Accountable Care.
Thank you.
If you are interested in learning more about accountable care or how organizations can succeed in today's healthcare system, please visit our website, www.dayhealthstrategies.com. Check out our blog, follow us on Twitter, and join our mailing list. We regularly post content relevant to current healthcare issues and overcoming challenges in delivering value-based care. Unlocking Accountable Care is a production of Day Health Strategies. Direction and editing by Max Blumenthal. Additional support and research by Emily Eibel and Nico Lehman. Our producer is Rosemarie Day. A special thanks to Purple Planet Music for the use of their songs.